Okay, so I'm walking into the room. I'm going to wash my hands, put on gloves, and provide the patient with privacy. Hi, my name is Lilia. I'll be your nurse today. Can I get your first, last name, and date of birth?
Lilia Salazar, 9/11/62.
Okay, perfect. Nice to meet you. Do you have any allergies we should know about?
No,
Okay, great. So what brings you here today?
I have pain
Okay, and where's the pain?
right here.
Okay, so you're having some right upper quadrant abdominal pain. When did that pain start?
Like the day before yesterday.
Okay, have you ever had anything like this before?
No,
Okay, and were you doing anything when the pain started?
no,
Okay, just came out of nowhere, nothing precipitated the pain.
no.
Okay, and how would you describe the pain?
Aching.
Aching pain, okay. And does anything make it better or worse?
No,
Okay, does the pain radiate anywhere else?
no.
All right, and if you were to describe the pain on a scale of 0 to 10, 0 being no pain at all, 10 being the worst you've ever felt, how would you describe it?
Like a 5.
Like a 5, all right. So do you have any nausea, vomiting?
A little nausea.
Okay, and how long have you been nauseous for?
A little more than a day.
A day or so, okay. And have you actually vomited?
No.
And what about your bowel sounds? Have they been normal for you?
Yeah.
Are you constipated?
Yes.
You're constipated, okay. So when was your last bowel movement?
The day before yesterday.
Day before yesterday, okay. And was that normal for you? Yes.
Yes.
Okay, so stools were formed. All right, great. And do you usually go a couple days without going?
Yes.
Okay, so you suffer from some constipation. So what we're gonna do is I'm gonna go ahead and do a head-to-toe assessment. I'm gonna check your abdomen. We're gonna relate the findings to your doctor, and then we'll see where we go from there. Is that all right? Okay, perfect. So can you tell me where you are today?
Hospital.
All right, and what year is it?
2020.
And who's the president?
Trump.
Okay, so my patient is alert and oriented ×4. She seems to be well kept and groomed, everything normal, and she does not seem to be in an extraordinary amount of pain at the moment, and she is calm and not agitated or anxious at the moment. We did go ahead and do her BPs before starting. Everything is within normal range, so her BP is 120 over 73, heart rate's 84, respiration 16, and her O2 stat is 90% on room temp, and her temp is 98.6. So I'm going to go ahead and start at your head. Okay, hair on the head looks normal. No abnormalities with the skin on the head. No scars, lesions, any edema. Can you go ahead and smile for me? All right, great. And I'm going to go ahead and check your ears now. Go ahead and move to the side for me. All right, just checking for any drainage. Other side. Just checking for any signs of infection, color. All right, do you wear any hearing devices? Have any hearing aids, anything like that?
No.
Okay, I'm going to go ahead and whisper something in your ear now and tell me what you hear.
1, 2, 3. 1, 2, 3.
Okay, great. So I'm going to go ahead and look at your nose now. Go ahead and back with me. Okay, I'm just checking for any drainage, redness, any signs of infection. I'm going to go ahead and give you this. I'm going to tell you to smell it. Close your eyes. Tell me what you smell.
Coffee.
Okay, great. Cranial nerve 1 is intact. Okay, I'm going to go ahead and move down to your mouth now. I'm just checking the lips for any signs of cyanosis, skin breakdown, any signs of dehydration. Can you go ahead and open your mouth for me? Say ah, ah. Move your tongue from left to right. Okay, can you swallow for me? Okay, great. Cranial nerves 9, 10, and 12 are intact. All right, and I'm going to go ahead now. And do you wear any dentures?
No.
You have all your teeth, no issues with your bleeding gums, anything like that? Okay, so I'm going to go ahead and start inspecting and palpating your neck. Just checking for lymph nodes. No hard or palpable lymph nodes. Trachea is midline, no goiter present. Go ahead and look to the left for me. Left. Turn your head. Just checking for JVD. Other side. Okay, great. Okay, now I'm just going to check the carotid pulse against the radial. Just checking for symmetry between the two. Okay, great. And now I'm going to go ahead and auscultate the carotid arteries. I'm going to do so with the bell of the stethoscope to check for any bruits. Okay, great. So I'm going to go ahead and inspect your eyes now. So go ahead and look straight forward. Just checking for curl up. Pupils are constriction on both sides. And I'm going to go ahead and move the pen from side to side, so just move your eyes, but don't move your head. do one more test. I'm going to do the 6 cardinal gaze, so just go ahead and move your eyes again with the light. Okay, there's no redness or drainage around the eyes. Everything looks normal. Can you go ahead and smile again for me? Okay, can you shrug your shoulders up and down? Okay, and I'm going to go ahead and put this on your face. Can you close your eyes and tell me if you feel it?
No.
Where do you feel it?
Chin.
Okay, great. So I'm going to go ahead now and inspect your chest. So first off, do you smoke?
No.
Do you have a cough currently? Okay, so I'm going to inspect your heart sounds and your lung sounds. And then I'm going to go ahead and start with your heart first. So have you ever had a workup for cardiac disease?
No.
Do you have any chest pain, heart issues? All right, great. So I'm going to go ahead and start with that. Okay, I'm going to go to the midclavicular line, second intercostal space on the right-hand side, they ordered. S2 is greater than S1. Go ahead to the left second intercostal space, the pulmonic. S2 is also greater than S1. I'm going to go to the third intercostal space, the Erb's point. S1 and S2 are equal. I'm going to go to the fourth intercostal space, the tricuspid. S1 is greater than S2. I'm going to go to the fifth intercostal space, the mitral valve. And S1 is also greater than S2. So I'm going to have you sit up for me a little now. Okay, just move slightly forward. Okay, just checking the apical pulse for 1 full minute. And now I'm going to check your lung sounds. So go ahead and breathe in and out for me. Check the back side. Okay, you can sit back. Okay, so skin on the chest looks normal. There's no signs of scars or trauma. Skin seems to be intact. Skin on the back is intact all the way down to the sacrum. So now I'm going to go ahead and have you sit up for me and just dangle your legs on the side. And do you use any assistive devices for
No.
walking, such as a cane or a walker? All right. So just have your legs dangle. Can you go ahead and do this for me? As fast as you can. Okay, patient's performing rapid alternating movements. And can you go ahead and put your heel to your shin and move it down? And on the other side? Okay, perfect. And I'm also going to test for your reflexes now. So go ahead and dangle your arm like this. Just let it loose. I'm going to check here. Here like this. Here. And your patellars. Okay, perfect. Okay, so now do you feel good to get up? Okay, so I'm going to have you get up. I'm going to have you put your arms to the side. Okay, and go ahead and close your eyes. I'm just going to check for swaying. Okay, perfect. Now I'm going to have you walk towards me. Open your eyes. Walk towards me. You can put your arms on. Okay, and turn around and walk back. Any dizziness or anything like that?
No.
Okay, you can go ahead and sit back down. Okay, I'm going to go ahead and check your abdomen now where you're having issues. So I'm just going to inspect first. There's no masses or anything like that. There's no skin changes, no skin breakdown. I'm going to go ahead and auscultate now, starting at the right lower quadrant. Okay, and I'm going to go in the middle of the abdomen where the aorta is. And I'm going to go ahead and check for any bruise with the bell of the stethoscope. Okay, so bowel sounds are heard on all 4 quadrants. I'm going to go ahead now and percuss using the indirect method. I'm going to palpate now for any tenderness. I'm going to do so with the right upper quadrant last since that's where she's having pain. So go ahead and tell me if there's any pain.
Yes.
Okay, so that's where you're having some pain. Did you have any issues urinating?
No.
Anything like that? No blood, foul smell in the urine? Okay, so go ahead and put your arms out like this for me. Okay, just checking for symmetry between both arms. Go ahead and push up for me. Okay, great. Just checking the skin now. Skin is intact. Just checking the nails for clubbing, cap refill, no splinter, hemorrhages. I'm just going to go ahead and check the radial pulses and the brachial pulses for symmetry. Go ahead and move your arms in a circle like this for me. And then flex them in and out. Okay, great. Now go ahead and open your legs for me. Go ahead and lift your legs up, push against my hands. Okay, great. And go ahead and bend your knees. Great. And now move them out. And move them back in. Okay, perfect. So skin is intact, just checking for hair distribution. No swelling of the calves, no signs of pitting edema. Checking the dorsalis pedis pulse and the posterior tibial pulses. Everything looks good. Okay, so the cap refill was good on both sides. And is everything all right at home? Do you feel safe? Do you have any depression, any thoughts of suicide? All right, great. So thank you so much for being a patient today. We'll get back to you.
Okay.